Hello, Thomas Malchow here. In this video, we're discussing isolated activation for our anterior tibialis. First, I want you to try something for me. I want you to stand up, feet together, hands on your hips. Now, without leaning to your right, I want you to first close your eyes and then lift your left foot. And see if you can balance in this position for 30 seconds, and then try the same thing on the other side. Professional golfers have the ability to balance on each leg with their eyes closed for 30 seconds. And the reason they can do that is because they have great intermuscular coordination in their lower leg. Intermuscular coordination describes the ability of agonist and antagonist muscles to cooperate to perform movements and to balance. But what does that mean? What does cooperation between agonist and antagonist muscles mean? Well, I'm going to use my elbow as an example. When I flex or bend my elbow, my central nervous system must send excitatory impulses to my biceps, getting them to contract, but it must also send inhibitory impulses to my triceps, getting them to relax. And this is how we move. Every time you move, every time you try to balance, your central nervous system sends excitatory impulses to some muscles and inhibitory impulses to others. And the better the linkages between excitatory and inhibitory impulses, the more coordinated you will be, the better balance you will have, and the faster you will move. Now, muscle imbalances are a combination of short and overactive muscles and long and underactive muscles. And they decrease your intermuscular coordination because they disrupt this linkage between excitatory and inhibitory impulses. If you found it difficult to balance on one leg with your eyes closed, it might be because you have muscle balances in your lower leg. Now, all great golfers use the ground properly during their swing sequence, giving them great balance, sequencing, and power. But if you have muscle imbalances, your skills will be diminished. Now, the tibialis anterior is a muscle that has the propensity to become long and underactive, and when it does, it decreases your coordination. Now, this is my favorite activation exercise for this muscle, but before we get to that, a little anatomy lesson. The tibialis anterior originates from the lateral condyle and upper 1/2 to 2/3 of the lateral surface of the tibia. It runs down the front of your shin, crosses medially, and inserts under your foot at the base of the first cuneiform bone and first metatarsal. It's responsible for dorsiflexion, which is this movement here, as well as inversion, which is this movement here. It also helps support your arch. So when it becomes long and underactive, your feet flatten and turn out, which causes external rotation of your tibia, relative internal rotation of your femur, driving your knees in. And as we learned in a previous video, this is lower extremity dysfunction. Now, before we get to the actual exercise, there's a couple things I want to talk about with the setup. I have the foam roller here, I have the yoga block here to elevate my heel. And that's because we need a little downward angle with the band. If there isn't that downward angle, the band has a tendency to sort of flop off your foot when we do it. Now, whenever we do an isolated activation exercise, there's a few things we need to figure out. One is, what is the joint involved? Well, we know it's the ankle joint, okay? Then we must determine what is the movement. Well, it's dorsiflexion and inversion. Once we learn those things, we then need to figure out what are the overactive synergists. You see, muscles are designed and organized to either be prime movers, synergists, or stabilizers. Prime movers dominate a movement. Synergists help the prime mover perform movements, and stabilizers support the body while prime movers and synergists perform movements. When the prime mover becomes inhibited, the body recruits the synergist to do more work, and eventually the synergist can become dominant in that movement. And that is called synergistic dominance. Synergistic dominance is a bad thing because it leads to movement inefficiencies, instability, inflammation, and injuries. Basically, your body has come up with a compensatory pattern that allows you to get by normal daily activities, but in doing so has created wear on your joints. Okay, so what are the overactive synergists to our anterior tibialis? Well, the overactive synergists are extensor hallucis longus and extensor digitorum longus, and we're going to have to come up with a way to reciprocally inhibit these guys. But let's get down into position first. I'm going to take my shoe off so we can see what's going on. And I'm going to get into a long sit position. I'm going to place the band around the base of my foot. If I were to put it up higher, that would provide a larger moment arm, which would provide greater resistance. However, that area of our foot, there's a lot of tendons running through that area, and it's kind of a sensitive area. Putting the band higher up could irritate those tissues, which could lead to inflammation and cause dysfunction. The last thing we want to do when we're trying to get out of dysfunction is cause more dysfunction. So put the band down at the base of your foot. Now, the movement involved is dorsiflexion and inversion. Okay, so the overactive synergists are the big toe extensors, extensor hallucis longus and extensor digitorum longus. Now, we just learned that when we perform movements, the central nervous system sends excitatory and inhibitory impulses. Well, since the big toe extensors extend, if we flex our toe, in order to hold that flexion, the central nervous system has to send inhibitory impulses to extensor hallucis longus and extensor digitorum longus. And in that way, we can exploit reciprocal inhibition to inhibit the overactive synergist when we perform this movement. And this has now become a very isolated exercise for the anterior tibialis. So this is the movement. As we dorsiflex and slightly invert, we're going to flex the big toes, or flex all the toes rather, and then relax. So the tempo is going to be up for 2, hold for 4 with the toes flexed, and then back down for 2. Now, the great thing about this exercise is we can progress it to integrate the recruitment pattern we use during our swing. So when we swing a golf club, our glutes, quads, and anterior tibiali all work together to create power. And so I can dorsiflex, invert, flex my big toes, and then contract my quad to start to integrate or reinforce this recruitment pattern. Now, I might want to put something under my knee to support my knee in case I start to hyperextend my knee, which is probably a good thing to have some support there. So again, I'm going to dorsiflex, invert, flex my big toes, and contract my quad. Hold that for 4 seconds and relax. But we're not done. We want to get the glutes involved. So what we're going to do, we're going to dorsiflex, invert, flex the big toe, contract the quads, and contract the glutes. And now we're reinforcing an actual recruitment pattern that we use when we swing a golf club. And we've just turned this isolated activation technique into an integration exercise that reinforces correct swing mechanics. So with all of our activation techniques, we do 12 to 15 reps. And again, with this one, we're holding for 4 seconds at the end range, 2 seconds back to the start, back up, hold for 4, contract the quads, contract the glutes, 15 reps, and then stand up and attempt to balance on your leg again with your eyes closed. I hope you enjoyed this video. Thank you for watching.